Hey, good morning. We're back on Sunrise at 5:16 on your Tuesday, and virtual is now the new normal, even for doctors practicing medicine. Many hospitals and medical professionals have offered telemedicine, but now it's really the best option for non-emergency care because of those COVID-related restrictions. Dr. Rosalia Mizzeri is the director of the pediatric urology team at Riley Children's Health right here in central Indiana. Well, for at least 8 years, she's been conducting virtual visits with patients in places like Fort Wayne and down in Evansville. But the majority of her appointments were in person at Riley until now. Now, Dr. Mizzeri tells me 90% or more of her visits are done virtually.
How's it going so far?
So there certainly are some challenges related to them. For example, the internet and the reliability of the internet in some locations, getting parents set up on the visits. And of course, they're tending to their children the same time they're talking to us. But it's actually gone smoother than we thought. We had dipped our toe into the world of telehealth previously, where patients would go to certain locations to be seen. And so some of us are familiar with talking to someone in a virtual fashion, but this really has changed it in that we can communicate from our home to the patient's home.
Obviously, you've adapted very well. How have the patients adapted to these virtual exams, so to speak?
You know, fortunately, in this age of FaceTime and things like that, parents are often used to communicating with grandparents and things like that over those applications. So it's been better than I thought it would be. I think we've adapted much more quickly than I anticipated we would have adapted.
In order to book a virtual non-emergency visit for your child with a doctor at Riley, you would book an appointment the same way as if it were in person, and the team at Riley will let you know when your virtual appointment is and instruct you on how to use their encrypted video service, which is more secure than what we used for our interview. Also, keep in mind, other medical services are able to do appointments so virtually as long as it's not an emergency. Methodist Sports Medicine, for instance, is expanding its non-emergency orthopedic service to include telehealth. They say their virtual care is mobile friendly and offers privacy that's compliant with HIPAA. To book a virtual appointment, go to their website, which we'll have with this story on WTHR.com. Also, for those of you in our southern viewing area, Southern Indiana Orthopedics, which operates in Columbus and Seymour, is offering telehealth for non-emergency visits too. They say their technology is also secure and complies with health privacy laws. Go to WTHR.com for more information. It's really incredible, and I just want to thank the physicians who took the time out to talk to us to let us kind of ease the minds of patients, Julia, because I know for a lot of people it's foreign, right, to have a doctor's visit virtually, kind of like I'm talking to you right now, but it's really incredible what they can do and diagnose.